I mean, in general, if you need a long sleep time, so in the business we talk about sleep opportunity, and most adult humans sleep on average for, let's say, 7 3/4 hours, but we can call this the 8-hour sleep. Now, if you're somebody who needs 10 hours of sleep, for example, that could just be that you're at one end of the normal range, but it could also indicate that you have a sleep disorder. So if you require a very long sleep time, it's certainly worth checking on the sleep quality. I mean, there are also other things that come around with sleep. So I think perhaps the most common one is whether you're a lark or an owl. We know that some people like to get up very early and go to bed very early, and other people like to go to bed late and get up late. And again, that's perfectly normal up to a point, but when circadian rhythms become very abnormal, then it raises the question of circadian rhythm disorders, which are a rare family of diseases, often with an underlying genetic basis. The pathway for investigating sleep disturbance is sort of straightforward. We tend to recommend that you first have a consultation with a sleep specialist. The purpose of that, of course, is to understand your symptoms better, both to try and get a clue as to the cause, but also to understand their severity. But we do also accept open access referrals here at OneWelbeck Lung Health from general practitioners and other specialists who are not sleep specialists. But either way, at some point, if there's an issue, you're going to need to meet with a sleep specialist so that he or she can evaluate your symptoms. At some point in the journey, either before or after you see the specialist, a sleep study is likely to be necessary if we want to understand what is the cause of sleep disturbance, because it's really difficult to get further forward without some data. The sleep studies that we do at OneWelbeck Lung Health use a home sleep study equipment, so you will sleep in your own bed, but you would come up here one day to pick up the equipment and then bring it back to us the following day, and then we download the data, and myself or one of my colleagues will analyse the data and prepare a report, and that can form the basis of a consultation to decide about treatment after that.